My wife does not eat the food we give to her, and she keeps, she keeps smelling the food, whatever we give it to her, and like she sniffs the food. And when we ask her why does she do that, she does not say anything, and it looks like that she keeps finding something in the food if we have put something in the food, and we just don't understand. And at times she does not eat anything at all, like she would not drink or eat anything we give it to her. A lot of times we have also found her found her outside the room as if she's trying to hear whatever we are talking. So that is what a patient of mine told me. That's what his concern was about his wife. So these are the very subtle symptoms we see, and a lot of times this is actually, we call it like a prodrome phase of psychosis. It might get into full-fledged psychosis like schizophrenia, and it might not, but these are the signs we find a lot of times in the patients. So what happens is, a lot of times patients develop this delusion. Maybe before delusion, this can be called as overvalued ideas, and if it gets to a severity where the person is not like eating anything at all because they think that what if any family member, and at times the spouse, have put something in the food, so they become very paranoid, right? And they, like he said, that she keeps listening outside of the room, so they are trying to hear if people are talking about them, and if they're trying to, like, if they're planning something against them, right? So these are the kind of symptoms we see. Now this is delusion, and with this example I'm gonna sort of explain what hallucinations are and what delusions are, which we see often in patients of schizophrenia and psychosis, other forms of psychosis as well. So delusions are the beliefs, are the, they are the thought, like I'm thinking what if that person wants to kill me. Hallucinations are more on a sensory level, as in the senses are involved. It can be hearing, it can be visual, it can be tactile, it can be olfactory, it can be gustatory, as in it can be taste, it can be smell, it can be touch, it can be like you're seeing something, it can be you're hearing something. The most common ones are the hearing ones, like you hear some voices, some noises. Then visuals. Visuals are less common than the auditory ones. So we are trying to ask the family members, especially, that ऐसा तो नहीं होता कि अकेले बैठे होते हैं तब भी आपको लगता है कि कुछ मुंह चला रहे हैं, या फिर as if they're talking to somebody, like somebody is in front of them, or like they're just like self muttering, they are just self talking. तो वो बोलेंगे कि हाँ, कभी कभी ऐसा लगता है कि खुद से मुंह चला रही है, कोई आसपास होता भी नहीं है तब भी ऐसा करती है, right? So these are the very basic common symptoms which you can also ask, and patients are also, they're sort of they also like sort of able to understand what you're asking, and they're able to answer. तो जब आप पहले ये पूछ लेते हो, उसके बाद you can go on to another level and ask them what other symptoms do you see in your family member. So yeah.